The University of Melbourne wants you to know that your safety and well-being continues to be our #1 priority. As we begin our pivot from a virtual campus to our physical campus, we must support each other. We want to show you what we've been doing to make the campus COVID safe for your return. My name is Crystal Polson. I'm a nurse and the infection control coordinator here at the university. Over the next few minutes, I'll tell you what you need to do before returning to campus and what we all need to do when we return to campus. We can't wait to see you, but before you return, there are a few things we need you to do. First, if you are unwell with a new illness and experiencing any of these symptoms, fever, chills, sweats, cough, sore throat, shortness of breath, runny nose, or loss of your sense of smell, please stay home. The DHHS is now recommending that anyone with symptoms, even mild ones, should get a COVID-19 test. The University Health Service can help arrange testing and answer your questions. You should also stay at home if you're required to isolate for any reason. This includes if you've been told by the DHHS that you've been in close contact with someone who has COVID-19, if you've returned from overseas travel, or any other valid reasons. All staff, students, contractors, and visitors are required to complete an online health declaration and agree to practice the hygiene and physical distancing measures required to keep us all safe. Building access will not be granted until the health declaration is completed. It only has to be taken once, but the principles must be practiced daily. More on this later. You can access the health declaration at the web address listed right here on this slide. To finish this process, all you have to do is complete this training module, and you're doing that now. The university wants to do everything we can to support you whilst you are away from our physical campus. If you're a graduate researcher and are unable to return to campus, you should have a conversation with your supervisor to agree on a suitable approach. If you're an employee and you are unable to return to campus, talk to your manager. They can help you understand leave entitlements you may be eligible for, such as quarantine leave. Now, if you're all set to come back, there are a few things you'll need to do on campus to keep yourself and others safe. Let's start with our hands. We've made it easy for you to keep your hands clean by placing hand sanitizing stations in common areas throughout the campus. Make sure you wash your hands for at least 20 seconds or use a hand sanitizer as you enter and leave buildings, after handling equipment, before and after eating, after using the bathroom, and after touching your face or using a tissue. Speaking of clean, we've been preparing the facilities for your safe return with more frequent disinfections and cleanings. We've made sure that disinfectant wipes or sprays are available, should you need them, to wipe down high-touch objects and shared areas in your environment. And I'm sure you all know this one, but remember to cover your face when you cough or sneeze. You can do this with a tissue that you'll immediately discard, followed by washing or sanitizing your hands. If you don't have a tissue, cough or sneeze into your elbow, and of course, wash or sanitize your hands straight after. And even though you'll probably want to give your long-lost work bestie a big hug or a friendly handshake, you'll have to refrain for now. We continue to follow the government's advice on physical distancing. This means keeping a distance of at least 1.5 meters between yourself and others, and being sure there is 4 meters squared per person in enclosed spaces. Work practices such as leaning over your coworker to help them with an Excel formula will have to be put on hold for now. And sadly, generous gestures like bringing in a birthday cake for your colleague can't happen. Besides, think of all the germs that get blasted around when those candles are blown out. We've made it easy for you to practice physical distancing by placing markers on the floor indicating 1.5 meter distances and placing room capacity limit signs around our campuses. We've also reconfigured some of our classrooms, lecture halls, offices, and other enclosed spaces to allow for adequate distancing. You'll also notice that we're keeping some of our common areas closed for now. Wait, we're not done yet. Another thing we're doing to promote a COVID-safe campus is improving air circulation by opening windows where possible and encouraging folks to conduct activities in the open air if feasible. If you are in an environment with windows, open them if you can. This may be difficult on cold winter days, but rug up and let the fresh air in. Campus services are also altering heating, ventilation, and air conditioning systems to increase air exchange rates where possible. When on campus, you should limit the number of buildings you visit to minimize the mixing of people. Spend only as much time as is required on campus to complete your work or your activities. And even if you're physically on campus, it's a good idea to continue to conduct meetings via Zoom. It's incumbent on all of us to keep track of all the people we interact with and the places we visit. We strongly encourage you to download the Australian Government COVIDSafe app. This helps with contact tracing. If you don't get the app, you must keep a record of the dates, places, and contact information of the people you meet on campus. In the event of a confirmed case on campus, the DHHS can use this app to assist in their contact tracing efforts. The university's own internal contact tracing team will support this process. Just as we've been working hard to prepare our campus for your return, Public Transport Victoria are preparing the public transport network for people to get to work and study safely. If you'll be using public transport, follow PTV's advice and it can be found on their website. If possible, avoid traveling during peak times. Despite our best laid plans, COVID-like symptoms can strike at any time. If you have serious symptoms such as difficulty breathing, call 000 and ask for an ambulance. If you begin to feel unwell on campus and develop a fever, cough, sore throat, or respiratory illness, please leave immediately and go straight home. You can arrange to be tested or seek advice from the University Health Service COVID hotline or by calling the DHHS COVID hotline. The numbers are right here on this slide. You can also consult with your local GP. No matter where you are, if you are diagnosed with COVID-19, we encourage you to let us know by sending an email to campus community. This way, we can offer the support you need to get well. The address is right here on this slide. Each of us plays an important role in keeping our university and its people COVID safe. We must continue to be vigilant, practice good hygiene, and follow physical distancing protocols, both on and off campus. And it's up to everyone to stay home if you're not feeling well. The University of Melbourne is a strong, supportive community. We'll get through this together. Stay connected with friends and family, and take advantage of the support services we have available here, such as EAP and the Health Service. We look forward to welcoming you back to our physical campus soon. Please look after yourself and look after each other.